*0. I would like to hand over the conference over to your speaker today, Mr. Michael Chalmers. Go ahead, sir.
Thank you for joining us for the COVID-19 media briefing for February 22nd. We'll start today with opening comments from Health Commissioner Jan Malcolm and Infectious Disease Director Chris Ersman. We'll then open it up for questions from reporters. With that, we'll now turn it over to Commissioner Malcolm.
Thank you. Good afternoon, everyone. Well, around the world, we're now over 111 million cases and 2.64 million deaths from COVID-19. In the United States, we're now over 28 million cases and have passed the 500,000 marker for fatalities due to COVID-19 in the United States. Here in Minnesota, we reported an additional 872 cases on Saturday, 885 on Sunday, and 561 cases today, for a new cumulative total of 479,591 laboratory confirmed cases since the start of the pandemic. Today's 561 new positive cases were on a volume of 17,666 lab tests results reported yesterday. Week over week, our weekly change in cases is just a little bit less than it was the week before at 1.1%. And the weekly change in testing is stable, 2.7% more tests this week than last. But on a population basis, our testing rate does continue to trend down. The 7-day average testing positivity rate is at 3.6%, which is below the caution category. I just want to mention that we do track these data, the cases per 100,000 and test positivity and so forth around the state, and do note that in some regions the cases per 100,000 are still above the high risk indicator and increasing in the lag period. So just to mention that it's very important that we keep looking at these numbers very carefully and looking for any regional variations. We reported another 11 deaths from COVID-19 on Saturday, 9 on Sunday, and 1 single death that was reported this morning that was reported to us yesterday, bringing us to a new total of 6,433 Minnesotans who've lost their lives to COVID-19 since the start of the pandemic. 235 people are currently in Minnesota hospitals being treated specifically for COVID-19, and of those, 48 are in intensive care. I will note that this is the lowest number of beds in use for COVID care in total since September 22nd, but it's the lowest number of ICU beds in use since early April. So those are very encouraging signs indeed. On the vaccine administration front, we are now at almost 1.12 million total vaccine doses that have been administered to Minnesotans, so 1,120,000 as of what was entered into our information system as of Saturday. This is both first and second doses. This is to a total number of Minnesotans who've had at least one dose at almost 760,000. And of those, 357,000 have now received the complete series or 2 doses of the vaccination. And really encouraging progress over the last 2 months that we have been vaccinating now. With that, I will turn it over to Chris Ersman for a further update.
Thank you, Commissioner. So I just wanted to give you an update on vaccine shipments. Last week, the weather-related shipping delays created challenges for state sites, local providers, etc. Some appointments had to be postponed. The good news is that we're seeing a return to normal on that front, and we hope to be back to normal operations and scheduling in the next week or so. We expect that Moderna orders that were originally placed for last week will be shipped and arrive to Minnesota sites between Monday and Wednesday of this week. All the orders for this week, February 22nd, are expected to be shipped and arrive to Minnesota sites between Wednesday, the 24th, and Friday, the 26th. A few remaining backlogged Pfizer vaccine orders for last week are expected to arrive today, and Pfizer vaccine orders for this week are expected to be shipped and arrive to Minnesota sites between Tuesday and Thursday of this week. So we're pleased that vaccine is coming into the state. Do recognize that if you receive a call for a rescheduled appointment, it is because of these weather-related shipping delays. As a reminder, the vaccine connector tool rolled out last week and is a great way to keep up with eligibility. You can sign up at mn.gov/COVID-19/vaccine/connector. And then I also wanted to comment on cases in community settings. Thanks to the vaccines and the hard work of so many Minnesotans, our overall numbers are looking much better than they did 2 months ago, but we still need to keep up our guard. In addition to concerns about potential impacts of the new COVID variant, we continue to see clusters of cases connected with community settings, such as restaurants, bars, and gyms. There has been a lot of focus on restaurants and bars, but people need to remember that there is a risk in any indoor setting that brings people from different households together. There are measures you can take to reduce the risk, but those measures don't bring the risk to zero. This is underscored by the point that our epidemiologists reported 23 outbreaks associated with gyms and other workout facilities in January. Because people without symptoms can spread the virus, people may not know that they may be spreading virus. The action that someone takes can protect the other people in the gym. Please do not work out in a gym if you have been exposed to someone with the virus. If you haven't been exposed and are working out, please wear a mask to protect yourself and those around you. Ensure that the equipment is wiped down between each use. Clean your hands and keep as much distance between yourself and others. If you are in a high-risk group, think carefully about the risks before going to a gym. The bottom line is that it's important to keep in mind that even with COVID precautions, indoor settings inherently present a higher risk than outdoor settings. We're getting closer to the end of this pandemic every day, and we can keep up our positive momentum by masking, keeping socially distant, staying home when sick, getting tested when appropriate, and getting vaccinated when it's your turn. And I'll turn it back to Mike.
Thanks, Chris. Operator, we're ready to take questions.
All right, thank you. So in order to ask a question, press star then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. All right, so our first question comes from the line of Jeremy from the Star Tribune. Go ahead, your line is open.
Hi, I wondered if we have any data tracking cases or deaths of COVID-19 among people who have received vaccine or have received both doses of vaccine. Do we have any such cases on record so far?
Chris, can you take that?
Sure. Yes, Jeremy, there have been individuals who have been vaccinated who have died, but the deaths have not been deemed related to vaccination. So in other words, we have been vaccinating in some of our most vulnerable populations that are older, and we would expect, even in the absence of COVID, when we have seen far too many deaths in this elder population, we would expect to see some deaths. So there have been deaths in individuals who have been vaccinated, but as I said, those deaths were not deemed related to vaccine. CDC is investigating every death.
And unrelated to a follow-up question, the Twins have put forward a plan to have 10,000 fans in ball games. Given what you just said about group settings, where are you at on either supporting or opposing that proposal from the Twins to have fans in the stands again?
This is Jan. I'll take the first shot at that. I think so many of us are looking forward to enjoying a game at Target Field, and You've heard that from the governor's office as well. He's personally eager to see Minnesotans get back to target field. And if people continue to work hard, if all of us continue to work hard, our twin fans and everybody, to keep the virus under control while vaccinations ramp up, we are truly optimistic about the possibility of fans getting back into sports venues in 2021. And so the governor's office and all of us in the relevant agencies will remain in close contact with the team and with all of our teams in the weeks ahead. And again, just to repeat, there is so much that we can do. We have a lot of individual and collective ability to impact this and to keep the variants from taking hold, keep the cases in a manageable level, helping to make sure that we can control hotspots by getting tested, by participating in contact tracing, all of those things. Not being really mindful, as Chris said, of if you've been exposed, you're not feeling well, staying out of circulation. There's just so much we can do to make it more possible to keep these case rates, trending down, which would just make it all the more reasonable to begin opening up. I don't have any specific comments on the Twins proposal other than to say directionally it's where we all want to go.
Thank you.
Thank you. The next question comes from the line of Theo from Fox 9. Go ahead, Theo, your line is open.
Hi to you both. I hear you saying that the 88,000 first doses that were expected last week, all of them are now set to arrive sometime today, tomorrow, or Wednesday, depending Pfizer or Moderna. This week's doses, I know the expectation was about 108,000. Is the expectation still to receive that number, just maybe a couple days later in the week, Thursday, Friday, Saturday?
Theo, so yes, the doses that were earmarked to have been delivered last week will come in their entirety this week. They're just coming, several days late because of the storm. And then the doses that were earmarked to arrive this week will all come in their entirety just a little bit later than usual, as the shippers are processing the week before and then getting to this week. And tomorrow is when we will see what our allocation for the upcoming week is. But yes, we do not expect, and there were no doses lost in this process. It's really just purely been a situation where doses couldn't be shipped because of weather conditions in the southern states.
And this is Dan. Sorry, Theo, I just wanted to take the opportunity to say, we just really appreciate the extra work that so many people are doing who are administering the vaccine, whether that be our healthcare providers, our pharmacists, our community clinics, our local public health, our state sites. Everybody's just working extra hard to try to maximize the number of doses that they can administer in the coming days with this sort of unusual situation. So there's just a lot of scrambling going on. We appreciate Minnesotans' patience with potential rescheduling, but folks are going to work really hard to administer a higher number of doses in a short amount of time.
Yeah, I was going to ask a related question, because you probably had some providers late last week that were sitting on their hands because they didn't have vaccine coming in. Now they're getting later in the week, a lot more than expected in a typical 2 or 3 day stretch. So do you think there's the capacity to administer all those shots that will be coming in this week, last week, and this week?
Yes, Theo, we do.
Yep. Go ahead. I was just going to say it's a lot of work, but we know people are scrambling. But Chris may have more granular information.
Well, I was just going to say that we do check with the providers. The governors made it clear the metrics that we're trying to achieve in terms of efficiency and vaccine administration. And so as we reach out to providers about the order that they will receive, we do check with them to make sure that they will be able to meet the metrics, barring anything unusual. And so we did have some providers that asked to change what their order was going to be in light of this week. But as I said, we are receiving the full number of doses, and so we anticipate that it will be a busy week for administration.
Okay, thank you.
All right, thank you. The next question comes from the line of Greta from Minnesota Post. Go ahead, Greta, your line is open.
Hi, I've got a couple of quick questions about long-term care. First, I'm wondering if all of the long-term care facilities have had a chance to get all their shots in, or just kind of what the status of that is. And then I'm also wondering if you can tell us any updates on whether the data are showing encouraging signs, or if those encouraging signs are kind of more sure now that we've got another few days of data, or just what you're seeing in terms of the numbers in long-term care.
Chris, can you take that? I think you've got more recent data than I do.
Yep. So all of our skilled nursing facilities have had the opportunity to have had their first doses, and many now are having the second dose visit. I do want to explain that at the second dose visit, there is the opportunity to receive a first dose. So residents and staff who may have been hesitant the first time around do have the opportunity to receive a first dose at the second dose clinic, and then there will be a third dose clinic. For our assisted living facilities, the vast majority have received their first dose or had that opportunity. We have just a couple that will finish up this week, but yes, by the end of February, all of our assisted living and all of our long-term care facilities will have had the opportunity to receive first doses. And then the process will be that in the ensuing weeks, we will continue to finish up on second doses and then have that third visit, so that anyone who deferred and decided to be vaccinated later has a chance to be caught up. And then yes, the data are very encouraging in terms of a significant reduction in the number of cases that we are seeing in our long-term care facilities. So that is positive. We are continuing to see that. And so I think the commissioner and I, as cautious as we are, can say that we see a positive trend in that area.
Thank you.
Thank you. Your next question comes from the line of Rachel from KLABC6. Your line is open.
Hi, yeah, I'm down here in Rochester, and none of our community pharmacies have received any of their vaccine allocations yet. So I'm wondering if that's a trend that's true for all of the community pharmacies in that program, because I know they had well over 1,000 people sign up, and all of those people are just waiting, and they don't really know when they're going to get the vaccine. So I'm just wondering if either of you guys have any information on when they can be expecting vaccines for the community pharmacy program.
Rachel, was it, or Chris, maybe you know if that was the new the federal program or part of the state allocation? Do you happen to know which program they're referring to?
Yeah, it was the state allocation program. It's like the community pharmacy, because we have 3 pharmacies here in Rochester that are part of it.
Yep. So Rachel, you may or may not have heard my opening comments, but because of the weather delays in the southern part of the United States, all of our doses for Minnesota were delayed, and the Moderna doses should be coming. The Moderna doses from last week should be coming in this week, sometime, today, tomorrow, and Wednesday. And then the doses, the remaining doses will be coming in. These pharmacies should be receiving information. They do get tracking information, so they should have that for the doses that they will be receiving.
Okay, thank you.
Thank you. The next question comes from the line of Peter from Minnesota Public Radio. Go ahead, Peter, your line is open.
I'm kind of following up on the long-term care data. We have seen a few deaths over the weekend in long-term care and today. And I'm curious if you have information about the people who've died from COVID in those facilities. Have they had the vaccination, or are they people who have not yet, or facilities that have not yet had that?
Peter, just to clarify. Oh, go ahead, Jen.
No, I was just going to say, I don't know that we would have enough case information data on that yet to answer that specific question, but you may have a different insight, Chris.
No, I was just going to say that all the facilities have had the opportunity now to have had a first dose. But the question is, did these individuals accept vaccination? And that's something that we can look at. The other thing is too, to keep in mind that, we'd be looking at two doses and 2 weeks after the last dose in terms of, protection.
Following up on the vaccination sign-up website, I'm curious if you have much data yet on vaccinations by race and ethnicity, or if you found have any indication so far of what that looks like in the state.
That's this is Jan. That's a really significant focus for us to be able to get more granular data, and that is going to be one of the benefits of the information that comes through the vaccine connector, to the extent that people choose to provide that data. It is voluntary, but it's extraordinarily valuable for helping us track exactly that. In addition, we are kind of analyzing the race and ethnicity data that we have from the state administered sites, as well as getting more of that disaggregated data from our healthcare provider partners and pharmacies. And so we're actively kind of taking a look at the data we do have so that we can report better disaggregated data. And that is, I can't tell you right off the top of my head specifically what days we'll be able to share that data, but we're actively working on that right now. But Chris, if you have anything preliminarily that you can share, go right ahead.
No, the team has been, as you said, pulling that together, and we're looking at those data, but nothing to share at this point. But certainly it's an area that we know that we have to work on.
Thank you. The next question comes from the line of Jill from Star Tribune. Go ahead. Your line is open.
Hi. The CDC's MMWR out today spotlights COVID clusters in Georgia elementary schools from December to almost the end of January. I know it's early in Minnesota, but do we have any data indicating clusters or outbreaks at Minnesota elementary schools that resumed or expanded in-person learning last month? And if so, what have we learned?
That is something that we are tracking week over week, and Chris, I think it's from the summaries that I've seen. I think we've seen a minor but noticeable uptick in active cases over the last few weeks. But I'll let you speak to that more fully.
Yeah, I mean, we're right, Commissioner. We certainly are seeing a small uptick, which is what you would expect, seeing kids back in school, but nothing that is concerning to us. In other words, we are seeing an increase, a slight increase in cases, but nothing that is unexpected, having brought kids back. And so we're continuing to follow that.
And the uptake in cases that you're talking about, was that in just the general population, or are you talking about among school-age kids?
We're talking about the cases that we monitor, right? So, I shouldn't say associated with schools. When I say associated with schools, I don't necessarily mean that the exposure happened in schools, but the cases that we monitor that occur in individuals who are of school age or who are employed in the education setting. So I want to be clear that we track those cases, but we do not necessarily, I don't want to suggest that the cases that we're tracking all had exposure in the school setting, because we clearly still see many cases with community, sports, all of those types of transmission.
Okay, thank you.
Operator, we have time for one more question.
Thank you. The next question comes from the line of Heidi from Care 11. Go ahead. Your line is open.
Hi, I was wondering, the governor had pledged that most teachers would at least have one dose of vaccine by March 8th, and I'm curious if you guys, looking at the rates right now, think that can be accomplished in time.
This is Jan. I think, it's a little trickier to kind of identify always by occupational group, given that people can and are getting vaccinated in a number of different settings. But I know that we're trying to pull those data and work with our colleagues at the Department of Education to estimate how many people have been offered vaccination, how many people have taken advantage of that opportunity, and where we are against that goal. I'm sorry I don't have a more quantitative answer for you today, but last I heard was a projection from sometime last week that we thought we were at about 25% of all educators that had actually been vaccinated, which is obviously a different number than what percentage have been offered a vaccine. So we're working on trying to get a little more insight into that.
Thank you. And then my other question is, do you know how many people have signed up for the COVID-19 vaccine connector since it launched?
I the last number I think I heard as of yesterday was over 300,000. So I don't have an accurate number. We can sure get that for you, Heidi, a more precise number if you want to follow up with our comms folks.
All right, thank you.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again soon.
This concludes today's conference call.